Hey guys, Josh Hoover here again to talk to you guys about safety. And in regards to safety, we want to talk to you guys about injuries and vehicle accidents. So unfortunately this year, or I should say last year in 2016, in regards to vehicle accidents, we did see a slight increase in the amount of vehicle accidents that we had. So the stats are showing that in 2015 we had 83 vehicle accidents, and then in 2016 we had 104, and then in 2017 we're right at 54 right now. So we're 5 months in, and we're kind of about, well actually we're almost a little over what we were on track for last year. So hopefully we can actually for the rest of the year minimize the amount of vehicle accidents and contacts that we're involved with and keep this number a lot lower than it was last year. So the big thing that we're doing though when it comes to vehicle accidents is we're hitting fixed objects. So things like not using a backer are actually affecting a lot of this. When you don't use a backer, you don't see maybe necessarily what's around you, or you don't have somebody there to guide you or tell you, hey, you're about to hit something, or hey, you're this close to hitting an object. So remember, when you're out there and you're utilizing your ambulance, the first most important thing is to not put yourself in a situation where you have to back up. So if you can actually get yourself in a situation where you can just pull away, that's going to be much better. However, if you do have to back up and it's a last resort and it's something you do need to do, make sure you have a backer out there ready to back you. And also make sure you roll down your window so that way you can hear them screaming and yelling at you before you decide to hit that building. So please, please, please utilize a backer. The next thing we need to also watch out for is we need to watch out for fixed objects that we may run into, whether it be sideways, laterally, or maybe we even just hit something that's right in front of us. So complacency is kind of an issue at times. It can cause you not to realize what's going on around you, and when we're complacent and we don't realize those things that are around us, we sometimes tend to hit them. So definitely make sure you're scanning the road. Make sure you also understand the size of your ambulance. And if you think you're really, really close to something, go ahead and stop. Take your time, give whatever, maybe it's another vehicle, a chance to get out of your way. Give them the ability to react to you, so that way you don't end up accidentally contacting their vehicle and having a vehicle accident. So if we can improve upon vehicle accidents, that would be an excellent thing to do. And if you have any questions, or even if you want to do a little bit extra practice, if you ever want to go to the EVOC track and maybe you want to practice a little bit, let me know. Give me a call. I'd be more than happy to allow you to do that. Now, let's talk about InThink. We've had InThink now for almost 2 years now, and it's, I think, finally kind of settling in. There were some bumps and some issues at first, but for the most part, we're actually seeing a lot of success with the InThink product itself. I know that a lot of individuals felt it may be a little bit too sensitive, but I can tell you our guys at the fleet department, the mechanics there and Jim, they've tested the vehicles. They've actually set the parameters themselves, so that way they make sure that they're not too sensitive. And if they are too sensitive, they actually can look it up and they can tell and see, let me know, and I can actually change that. Now, InThink product itself wasn't necessarily very similar to road safety. It's more of a coaching tool, and it's there to remind you, hey, you're driving a little too fast, or hey, you're driving a little too aggressive. So make sure you're listening to your InThink device. It's there to kind of help keep you safe and make sure that you guys get home safely. If you have any questions about InThink, please let me know. Also too, there is now a kind of an InThink program where if you drive above a 4.5, we're going to give you a pat for actually having great driving. So keep that in mind. Keep your driving scores nice and high. I know that when your driving scores are high, you're paying attention, you're listening to the InThink machine, and you're driving the way you're supposed to, which not only keeps you safe, but it also impacts patient care and the kind of quality of transport that patient has, which is ultimately what we're here to do. We're here to transport patients in the most efficient, safe manner and provide quality and comfort at the same time. So again, if you have any questions, please let me know. Now, let's talk about injuries. So injuries, unfortunately, are kind of on the rise too as well. Back in 2015, we had 79 injuries, and as of 2016, we had 85 injuries. So injuries were a little bit on the rise, and Patient handling happened to be one of the big injury causers. So patient handling, basically utilizing a two-person lift being very important, or even moving a patient over from bed to stretcher. When you're utilizing your people mover, make sure you're utilizing that along with the slider. That can actually be definitely a great way to move a patient over and not get injured. Let me go to some more individual statistics. So, for instance, stepping out of an ambulance. We actually had 9 injuries last year in 2016 from stepping out of an ambulance, which I hate to tell you, I shake my head a little bit. I know stuff happens, but again, please make sure you're using 3 points of contact at all times when exiting an ambulance. Also too, I know a lot of you think you're Superman, but there's no reason to jump off the back of your ambulance and fly in the air like Superman. I can tell you, when you do that 9 to 10 times a day, throughout your shifts and throughout the years of service, your knees will hate you and you'll have a lot of issues. So please do not jump out of the back of your ambulance or even out of the side of the ambulance. I know it doesn't seem very high, but again, that constant compact on your joints is going to degrade your body over time, and it's going to increase your chances of having an injury. Also too, footwear, extremely important. When you purchase footwear, make sure you purchase footwear that's a high-backed shoe that has laces or some kind of zipper that is relatively tight. I don't want it to cut off your circulation, but I want you to have that ankle support. Now, let's move on to lifting a stretcher. So last year we had 10 individuals that were injured from lifting a stretcher. So what that tells me is we're not necessarily utilizing the two-person lift as often as we should be, okay? Understand, when you lift with a two-person lift, you're taking half the load. Now, some people feel like, well, I don't work well with this person because they're shorter. Again, it takes practice. Practice makes perfect. You need to just work and communicate. Communication is huge. When you communicate with your partner, you should be able to perform that lift no matter what the difference is in size, and you should be able to get that patient into your ambulance without too much effort, okay? So again, make sure you guys are utilizing the two-person lift at all times. We've shown it to you in Fit Responder. You've probably seen it in orientation. Make sure you're utilizing that lift. It's super important. The next one was lifting a patient. So we had 9 injuries where individuals were lifting a patient. So if you're lifting a patient up off the ground, make sure you're utilizing your people mover like we showed you in Fit Responder. Go ahead and take that people mover, fold it into 3 different halves, wrap it around their back area, and utilize that people mover to use a leverage lift on that patient, okay? Again, Mega Mover, huge tool to be able to use. If you use it in conjunction with your slider, when you're moving patients, it's going to be the safest thing that you can possibly do. Not to mention too, when you use the slider in conjunction with the people mover, it makes the patient that much more comfortable. So again, we not only want to improve upon your safety, but also upon the patient's comfort and the type of experience they have while they're in your ambulance. The last one I want to talk about is combative patients. We actually had 10 injuries from combative patients. So we can definitely keep that from happening by understanding the warning signs of when we have a combative patient. Things like clenched fists, hyperverbal, they just look angry to you. When you see patients like that, okay, definitely want to try to keep your distance, but at the same time, try to de-escalate the situation. Don't be the individual that causes escalation. There's no reason we really shouldn't be having patients hurting our employees. And if you do have a patient that needs to be secured to a stretcher because they're combative, utilize the tools that you have. We have our Versed, we have our nasal atomizers, not to mention too, we have our hard restraints. I know oftentimes you want to use the soft restraints, but believe me, the hard restraints are awesome and work very well. I know some of you feel that maybe it might be a little too much, but I can tell you our hard restraints actually have padding on them to help protect the patient's arms. So make sure you're familiar with the hard restraints and don't be afraid to use your hard restraints when it's necessary, okay? So that's all I have about safety and our safety updates for you. If you have any questions, comments, or concerns, whether it be safety, anything involving risk, infection control, please let me know. You can reach me at jhoover@sunstarems.com, or you can call me on my work phone at 727-224-2110. And again, thank you very much, and I hope you guys all have a great day. Bye-bye.